Audio recording for this meeting has begun.
All right, everyone, welcome to our webinar this afternoon, our second Program Integrity webinar in the 2021 fiscal series. Today's webinar is Strengthening CCDF Program Accountability. A little bit of housekeeping before we jump into the presentation. We are planning for an interactive session and we'll take breaks throughout the presentation today for some facilitated dialogue. If a question or comment happens to come to your mind during the presentation, please feel free to go ahead and enter that into the chat pod, and we'll plan to address whatever comments or questions come in during the next break. The slides and some other relevant resources for today's presentation are available for download in that Program Integrity Resources pod in the lower right side of your screen. Those resources or that pod will be available throughout the presentation today, so feel free to download at your leisure, but prior to the end of the webinar. Related to the phone lines there, we do have a change. We were expecting well over 400 folks registered for today's webinar, so everyone is currently muted. However, if at any time you wish to unmute and ask a question, we may be able to do that, fingers crossed, but we will plan to use the chat pods for the most part throughout the webinar. What else? In relation to the phone lines, we do encourage our attendees to use your computer's audio if at all possible. Things just seem to go better if you're using your computer's audio. However, all of our presenters and hosts are on phone lines. Finally, if you should happen to have any issues this afternoon, please reach out to Heidi Freimiller. Her contact information is there on the screen. All right, so here are our presenters for today's webinar and NICSIA's Program Integrity Subject Matter Experts. My name is Leanne Bryan, and I am the Program Integrity Manager here at the National Center on Subsidy Innovation and Accountability. Shannon Mazzaraco resides in Rhode Island and is our Fiscal Management Subject Matter Expert. Janae Broadway lives in Louisiana, and Mike McKenzie in Wisconsin. Janae and Mike are our Program Integrity Subject Matter Experts. I'd also like to mention quickly that Program Integrity and Fiscal Accountability are just one small section of NICSIA. Many of you I see on our participant list throughout the webinar series, and you are somewhat regulars on these webinars, but our National Center also provides TA on other aspects of subsidy administration, such as eligibility policy and process, equal access, including assessing market rates and analyzing cost of care, and comprehensive background checks. And that is just naming a few. All right, let's see what is next. Next up is a welcome from the Office of Child Care. Hopefully, Monaquin Huggins is with us now. I'm looking at our attendee list. Oh, we're going to give this a try. So before I turn it over to Monaquin, I do want to acknowledge and thank Monaquin for her many years of service and dedication to the CCDF program. Due to her upcoming retirement, this will be Monaquin's last webinar with us. So congratulations to Monaquin, but also very sad to see her go. Monaquin, I truly appreciate all of the support that you have provided to both our National Center, but more importantly to CCDF lead agencies. I think the attendance on today's webinar, the high number of folks that are interested in this content area is a great indicator of programs that are striving to strengthen program integrity and fiscal accountability. We have valued your leadership and will continue to strive as a center and in partnership with the Office of Child Care to help meet the needs of all of these child care programs across the country. So Monaquin, thank you. I'm going to look to see, I see you in the room, but it doesn't look like you have audio yet. So we're going to keep on moving, Monaquin, but maybe towards the end of the webinar, you'll be able to jump on and say a few words in closing. So we're going to keep on going right now. So let's take a quick look at the agenda for today's webinar. We have taken previous webinar feedback into account when putting together the slide deck for today. We plan to touch on several different subtopics within CCDF accountability, but we're going to start with an overview of accountability and a focus on who's accountable. Next, we'll talk through CCDF accountability areas, including fiscal, process, and program accountability and strategies for maintaining accountability. Then we're very happy that we will have a representative from New Mexico's Early Childhood Education and Care Department, Ms. Antoinette Ortiz, with us, and she will be talking about their system strategy for ensuring accountability. We'll finish up the webinar with available resources and a wrap-up. Now I am going to turn it over to Janae Broadway to get us started on some of the content.
Awesome. Thank you, Leanne. So again, we want to thank you guys for joining us today and taking time out of your busy schedule. We hope that by the end of this presentation, you are able to walk away with some strategy considerations for strengthening accountability within your CCDF program. To get us started here today, and you all can just type your response in the chat box, what does accountability mean? When you hear the word accountability in the chat box, just go ahead and type in, what does accountability mean? It looks like we're having some logins. But we have Heidi saying taking responsibility, liability, Alicia, being accountable, Robin, being responsible, holding up your end of the bargain. I like that, Robin. We have a bunch of different ones coming in here. Following procedures and accurate reporting of activities. So in short, accountability means all of those things that you guys are typing. But let me start over. Accountability means all of those things that you guys are typing. But in short, it's basically us taking responsibility or being accountable, like you said. So who is accountable for the administration program? Well, the lead agency. Lead agencies are therefore held accountable. But why? The lead agency accepted overall responsibility of the administration of the CCDF program. And this acceptance included the commitment to ensure that the lead agency's administrative and operational activities comply with the approved plan and all federal requirements. Now, given the scope of the entire CCDF program, the federal regulations, they require at 45 CFR 9868A, it requires the lead agencies to have effective internal controls that ensure integrity and accountability while maintaining continuity of services. With that, we must understand that the lead agency's accountability activities should not result in an undue administrative burden for families. We also recognize that other entities partner with lead agencies and contribute to the success and implementation and administrative activities of the CCDF program. which leads us to our regulatory information surrounding entities. Keeping in mind this regulation that we'll talk about here in just a second, and others like it, are in place to support the accountability activities of the lead agency. So at 45 CFR 9811, it gives the lead agencies broad authority to administer the program through other government and non-government agencies. However, the lead agency is still responsible for the administration of the program. The added accountability support here is that the lead agency shall ensure that any administrative or implementation responsibilities be governed by a written agreement. So just like integrity, the need for accountability spreads throughout the entire CCDF program, and hence the reason why we see such terms as responsible or responsibility or accountable throughout the CCDF regulation. Now, let's dig a little deeper into some specifics. During this webinar, as Leanne mentioned, we'll highlight 3 accountability areas in CCDF: fiscal, process, and program. When viewing these areas and the strategies, think of integrity as the action being taken and accountability as the responsibility for the action. So let's begin with our first area, fiscal accountability. So what is fiscal accountability? It is the appropriate spending of public funds in a lawful way. Some activities include proper oversight of fiscal transactions, measuring and improving fiscal outcomes, and fiscal transparency. Now, as I go through this slide and the next 2 slides, I won't read off each of the activities, and the activities listed are not an all-inclusive list, but we will give specific strategies related to each of the accountability areas throughout this webinar. And if you'd like to have a deeper discussion, please reach out to your regional office program specialist, to request technical assistance, or provide your request for more information as you complete the webinar evaluation. For now, let's look at our next area, process accountability. We have defined process accountability for the purpose of this webinar as carrying out policies and programs as intended. And process accountability activities can include continuous training or retraining, enforcement of performance measurement goals that hold individuals and entities accountable, and implementing accountability tools within the child care system. We'll take a look at some child care system accountability strategies later in this presentation, but for now, let's look at our last area, which is program accountability. So program accountability is the establishing of program policies and procedures that produce the expected results and incorporate changes when needed. Some program activities, program accountability activities, you can see to the right of your screen, include supporting program transparency, supporting staff and stakeholder ownership of administration or administrative or operational activities, and empowering activities bound by results. So when we say empowering, we're talking about contributing to the confidence of staff to create or want to create internal activities that produce positive results. Now, let's take a moment here to reflect on the information presented thus far and compare it to your CCDF process. And if we take a look at the bigger picture, I think it's safe to say that we all can agree that when talking about accountability, it is embedded or should be embedded in a vast amount of the CCDF administrative or operational activities. But again, the purpose of this webinar is for lead agencies to understand, create, or review their own accountability activities, enhance their accountability activities, and request TA when needed. So keeping in mind the accountability areas and the definitions we provided, we'll now look at the accountability areas in a deeper discussion. And with our first accountability area, fiscal, I will turn it over to Shannon, our fiscal management SME.
Thank you, Janae. Up next, as Janae mentioned, maintaining fiscal accountability. I'm really excited to be going through these slides with you. Okay, so Federal Regulation Title 45, Subpart G, Section 98.68A1 states, lead agencies are required to describe in their plan effective internal controls that are in place to ensure integrity and accountability while maintaining continuity of services in the CCDF program. And that shall include, and it lists 1, processes to ensure sound fiscal management. Sound fiscal management is more than just proper bookkeeping. It is a critical component of ensuring the sustainability, effectiveness, and efficiency of the CCDF program. It requires consistent accountability of assets, deliberate internal controls, and robust regulation compliance, as demonstrated in the continuous quality improvement graphic above. This is an interconnected and iterative process that involves developing and maintaining budgets, establishing and implementing internal controls, monitoring regulatory compliance and program integrity, and repeating the process as needed to make necessary adjustments. Developing and maintaining budgets. In order to effectively manage the various funding sources, we need to know the federal regulation and program requirements. The CCDF program is comprised of 3 main funding sources: mandatory, matching, and discretionary funds, now coupled with CARES Act and forthcoming CURSA Act funds. All funding streams are available to states, while there are some restrictions on which funding streams go to tribes or territories, as outlined on the slide. Funds are allocated differently for each funding stream, based on different formulas. Discretionary funds are appropriated by Congress and are allocated based on free, reduced lunch ratio, per capita income, and number of children under the age of 5. Maximizing funding is an effective way to sustain and enhance your high-quality child care program. To do this, it is important to make note of obligation and liquidation periods. In general, an obligation is an action that commits the funds, for example, through issuance of a voucher or certificate to a family, and liquidation generally means the payment of funds to a third party, such as child care provider. For example, if the discretionary fund source is fiscal year 2020, the period of 10/1/19 through 9/30/20, they must be obligated by the end of the second fiscal year, September 30th, 2021, and liquidated by the end of the third fiscal year, September 30th, 2022. CARES Act funds must be obligated by September 30th, 2022 and liquidated by September 30th, 2023. And while we're not showing the CURSA Act funds in this chart, OCC guidance will be coming out soon. In addition to the funding streams outlined in this slide, tribal lead agencies have CCDF funds for construction and major renovation and have up to 3 years to liquidate these funds. Please note, the liquidation period begins with the date that the funds are originally awarded, not the date it is transferred to the construction and major renovation. We're going to take a pause for a quick poll question here to find out if any lead agencies have developed a tool outside of their existing systems for tracking CARES Act expenses. While everyone's answering the poll, we greatly appreciate your participation. For those of you who answered yes, I just want to see if anybody would be willing to share a little about what they did. And for those who said yes, would you be willing to share that tool with us so we can look at it and see if it's a potential to share with other lead agencies? All right. So it's looking like, I believe the results were about 26% of participants said that they did create a tool outside of their existing eligibility system. Thank you for sharing that. Continuing with the topic of developing and maintaining budgets, when limited funding exists or funding needs to change significantly due to emergency situations, tough budget decisions may need to be made. Variances in copay structures, reimbursement rates, and tiered eligibility systems can impact the ability of the lead agencies to support the continuity of high-quality child care. NICSIA has created a customizable budget calculator for state and territory use. This tool can demonstrate how these changes impact a lead agency's overall budget by looking at the impact of eligibility levels, rates, and copays on a lead agency's bottom line. States, territories can request individualized TA for the calculator through their regional office. Initial TA typically consists of a demonstration of the tool and exploring the possibilities of how it can support your lead agency. Follow-up TA varies based on the lead agency's needs. Some have a robust budget team and want to try it out on their own, and we can help as questions arise, while others may have the data to do this but not the staff time or expertise, and send their data to us to have the calculator built out for them. I also want to note tribal lead agencies have a separate budget tool developed by the National Center on Tribal Early Childhood Development. For any questions or TA support requests, please contact your regional office program specialist. Both tools are available for download in the resource pod. Establishing and implementing internal controls. Information provided here is at a high level and include a few sound considerations for lead agencies to promote stability for providers and continuity of high-quality child care, and is supported in the federal regulation Title 45, Subpart B, Section 98.11A3. Administrative and implementation responsibilities undertaken by agencies other than the lead agency shall be governed by written agreements that specify the mutual roles and responsibilities of the lead agency and the other agencies in meeting the requirements of this part. The contents of the written agreement may vary based on the role the agency is asked to assume or the type of project undertaken, but must include at a minimum tasks to be performed, a schedule for completing tasks, a budget which itemizes categorical expenditures consistent with CCDF requirements, and indicators or measures to assess performance. This is a general best practice in project management and is applicable to provider grants and agreements, contracts with various vendors, and even for internal practice for developing work plans that support the CCDF program. I just want to point out the program integrity tip at the bottom of this slide. Double check effective dates and grant amounts for accuracy, and keep in mind the deadlines for obligating and spending funds. Establish a method for tracking where and how grant funds are used. Continuing along the lines of establishing and implementing internal controls, the Grantee Internal Controls Self-Assessment Instrument can be used by state teams to evaluate how well a lead agency's internal controls are functioning and to determine what, where, and how improvements can be made. The instrument contains 5 sections corresponding to CCDF control standards such as eligibility determination and review, improper payment case review process, fraud and overpayment prevention, detection, and recovery, federal reporting, audits, and monitoring. Each section contains a list of program elements and considerations lead agencies may use when reviewing their programs and the degree to which their internal controls are effective. The considerations are examples of best practices that help provide a context for evaluating the context and scope of the elements. For those familiar with the instrument, it has just been updated to provide users with a more interactive and user-friendly experience. While the instrument may look different from the March 2019 version, the content has not changed with these updates. The instrument can now be completed digitally, or it can be printed and completed as a hard copy. The newly released self-assessment instrument is available in the handouts pod for download. If you would like to request an overview or TA related to this instrument, please reach out to your regional office. Monitoring and regulatory compliance and program integrity. Routine monitoring activities such as reporting enables lead agencies and their collaborating partners to be more accountable in their program integrity efforts. In this slide, we have a couple of reports. We have aggregate and case level reports, the ACF 700 for tribes and ACF 800 for states and territories. These reports provide annual counts of children and families served through CCDF, along with other information, including data on annual estimates of families, children, and providers served or supported by CARES Act funds. Reported annually for the federal fiscal year and due by December 31st. We have the ACF 800 for states and territories, which provides case-level data on the families and children served during the reporting period, along with other demographic information, including data on income for determining eligibility, monthly amount paid to providers, and hours of care during the reporting period supported by CARES Act funds. Reported either monthly, 90-day look-back period, or quarterly with a 60-day look-back period. Over here we have financial reports. We have the ACF 696, applicable for states and territories, which provides financial data on CCDF expenditures. States are required to report on the mandatory matching and discretionary funds, while territories are only required to report on the discretionary funds. Reported on a quarterly basis, due on the last days of January, April, July, and October. ACF 696T is applicable for tribes, provides financial data on CCDF expenditures for the tribal mandatory, discretionary, and construction renovation funds. This report is reported on an annual basis for the federal fiscal year and is due by December 31st. Both reports must include financial data on CARES Act obligation expenditures in addition to fourth quarter narrative describing the use of the CARES Act funds. Tribal grantees will need to report CARES and disaster relief or disaster relief used for construction and major renovation. Next, we have the Quality Progress Report, the ACF 218, which is applicable to states and territories. This report provides information on efforts to increase access to high-quality childcare, more specifically how CCDF quality funds were expended, including the activities funded and measures used by states and territories to evaluate progress in improving the quality of childcare programs and services for children. This report also includes data on how CARES Act funding has been used to support quality activities. This report is an annual report for the federal fiscal year, typically due on December 31st, but I just want to highlight for the fiscal year of 2020, the report has been extended to March 31st for this year only. Reporting is an opportunity to review outcomes based on lead agencies' data and, more importantly, to reflect back on their fiscal management goals with clearly defined expected outcomes and established internal controls to ensure adherence to policy, rules, and regulations. In order to identify areas in need of improvement or adjustment, and of course to celebrate successes. In order to do this, it is critical that lead agencies have proper systems and processes in place to trace funds to a level of expenditure adequate to establish that such funds have been used in accordance with the provisions outlined in Federal Regulations, Section 98.67. It is also good practice to have a central source document to document policy changes with associated time periods and how the lead agency plans to track. Additionally, lead agencies must track CARES Act and the upcoming Cursor Act funds separately from other funds. Okay, let's talk about it. I know that was a lot of information. I hope it was very useful to all of you. So we're going to take some pauses throughout the presentation to give you all an opportunity to ask questions of us and share information with one another. So our first break for discussion has two guiding questions. What processes have your agency implemented to ensure sound fiscal management? And the second question, how are lead agencies currently tracking expenditures related to various funding streams? We'll provide you with a few minutes to respond to the questions via the two chat boxes in the bottom of your screen. And we'll do our best to answer any question posed and help facilitate discussion, but there are times where we may need to follow up after the webinar.
Looks like we have a couple folks typing. Look forward to hearing your responses to this one. Again, just looking to hear you all share some of your experiences and strategies related to ensuring sound fiscal management, as well as how you may currently be tracking expenditures when there are various funding streams. Valentine, thank you for sharing your response. Using an accounting system, Oracle PeopleSoft. System allows for project numbers, yep, along with specific accounting stream or strings for use in tracking expenditures. Yep, this one sounds very familiar. All payments are assigned a number and contain sufficient support documents for expenses. Thank you. Yep, Philip Smith, expenditures are being tracked through our eligibility system as well as through payment. Yep.
It looks like we have a few more coming in. So we have some written policies and procedures that include segregation of duties monthly, ensuring that all applicable staff are trained on these policies and procedures. Thank you, Alicia. And we have Anthony's response. In general, Texas Workforce Commission implements sound fiscal management through a professional culture and accountability. Then we have Julia, using a compliance officer to assist the program in understanding if expenditures are eligible for federal guidance. It's a good practice.
Looks like we have just a few others typing related to tracking expenditures. We'll go ahead and let you finish those thoughts, and then we'll move on.
Alicia also shared state accounting system requires specific program number for federal funds when payments are made. The correct federal fund code is utilized. Very good. All right, in the interest of time, I think we'll keep moving along. I want to thank you for your time today. Up next is our Program Integrity Specialist and Subject Matter Expert, Janae Broadway. We'll walk you through maintaining process accountability. Thank you again.
Thank you, Shannon. So Shannon has provided us with some very beneficial fiscal accountability considerations and reporting requirements. And now we'll move to process accountability. But before I get started here, we're going to use the chat box again and see if you guys can remember what we defined process accountability as. And you can type your responses in the chat box. Let's see who remembers. No typing. That's okay. That's why we brought it. Oh, looks like Tamara Patrick. Give it up. Yes, ma'am. Exactly. That is perfect. Yep. And also Kim. That's correct. We define process accountability as carrying out policies and programs as intended. Perfect. So just like the other areas, fiscal and program accountability, there are many activities that a lead agency can look at in terms of process accountability. But today, we'll look at 3 specific process areas: technology, teleworking, and internal controls for fraud detection. So beginning with technology, we understand the child care system and its infrastructure should be aligned with the lead agency's CCDF program administration, right? So what we have here are just a few basic accountability strategies. The first is related to CCDF staff, onboarding, and routine training. Through these processes, the agency has an opportunity to ensure that all staff understand and accept responsibility when accessing the child care data system. Now, some additional activities to support this effort include inspiring staff to be accountable through incentives or recognition, and also correcting them when they are not. For example, many of you have internal software download policies. Some agencies may have system blocks or securities in place that will not allow outside software to be downloaded, while other agencies may rely on staff to follow the policies. For this type of accountability strategy or any other system activity, there are 3 questions an agency could ask when having those internal discussions. Who within the lead agency is accountable for ensuring this policy is followed by all CCDF staff? And is there a protocol when this policy is not followed by staff? An official protocol. And when I say official, we mean written. And are there any automations in place to send notifications to IT, management, supervisors, or anyone in leadership related to the software download activities? Or maybe software download is not a risk area for the agency. The idea here for this one or any other accountability activity is to take a step back and see where the risk areas are. And while implementing those internal controls, think of ways to also implement accountability strategies. So next we have security levels and roles. A good example here would be with eligibility and payment staff having different roles, responsibilities, and levels of security within the child care system. Here, a lead agency could have an embedded system edit or boundary that prevents certain activities that are not aligned with the end user role from happening, right? So you're preventing those activities or the end user having the ability to take those actions within the system. And to strengthen this accountability strategy, an agency could also consider giving responsibility and enforcement protocols to someone or something to notify the agency when actions are taken or attempted outside of the end user role. And next we have security plans. So how about security plans? Are they in place? Who has oversight of IT security plans? Having IT security plans in place is another accountability strategy. And those security plans should also be measurable with outcomes and proper oversight. For example, the IT staff and managers could have specific roles and responsibilities as it relates to the security plan in the child care system. The accountability strategy here would be to include in the manager roles and responsibility proper oversight and reporting related to the child care system IT security plan. And next we have, so lead agency systems or systems should support the child care program, right? But it should also support change. Changes will more than likely occur. We saw this during reauthorization and the recent pandemic. However, there may be future changes, not many. There may be future changes because of regulatory or organizational change requirements. And anyone familiar with a legacy system or an older system knows it can be a bit of a task trying to create even the smallest change within that system. And lags in system changes can have a direct effect on the continuity of care, payments, and more. And I'm not speaking bad about legacy systems. Some of you may still use legacy systems, and these systems have paved the way for the evolution with the technology, and they are great systems. And now we will move to conducting routine system checks, right? So scheduling for routine system checks with measurable outcomes is an accountability plus. Examples of this could be routine system checks to ensure specific policies within the child care system are followed, or security checks regarding user roles or software download capability. There are many different other types of system accountability activities a lead agency could implement. It's all about choosing the right fit for your agency. For example, going back to the specific roles, there are lead agencies that have implemented web-based eligibility software, which operates according to the Ccdf policy, their Ccdf policy and procedures. And we'll hear from one of those here shortly, New Mexico. An important note here is that accountability strategies should have measurable outcomes. And when thinking of system enhancements or implementations, there are two general basic questions a lead agency could ask to start those internal discussions. Will it increase and improve how data travels through our child care system, and who is accountable? Now let's move to teleworking. So teleworking has become popular, more or less as a result of the recent pandemic, and many states have successfully transitioned workers to off-site duties. Based on the feedback and to align our webinars with current trends, we thought we'd provide some teleworking accountability strategies, and this again is not an all-inclusive list. So again, we see here appropriate oversight. You'll notice oversight throughout the process accountability area, and this is because it's a necessary function. Someone or something will need to be responsible for the action. Performance measurement and enforcement activities. An easy question here is, how do we measure success? We have a process, but how do we measure success? Is there a corrective action for those who are not successful? And what are the protocols for enforcement? Now, what I'll add here is that enforcement protocols should be conducted consistently and with equity. But going back to measurable, for an example of this would be giving teleworkers a specific number of applications to process daily, or having a minimum number of daily eligibility interviews to be conducted by a worker. This could be done by looking at your already in place administrative data and having a conversation with staff. The intent here is the lead agency has or implements a measurable outcome for the daily work activities to hold workers accountable off-site. But maybe this example may not work for your lead agency. Maybe your agency does not want to set a process number for daily applications or interviews. An accountability alternative could be to assign someone or something the responsibility of monitoring work productivity off-site. The idea here is to get you thinking about what accountability strategies would work for your lead agency's administrative and operational activities. Next, we have protection of personal identifiable information. PII and confidentiality go hand in hand. Off-site access may require additional staff acknowledgments to specific policies and procedures for accessing those files off-site. I remember when I was in state government, when we were, and this is on-site, we were required to lock up everything prior to leaving our desk. And if your computer was facing a certain direction, you were to have a shield on it so others couldn't see the information as they passed by. While this may be harder to monitor off-site, this does provide a resource to staff to be held accountable in ensuring PII is safe and information is kept confidential. Another example would be the use of secured sites for data exchange, which moves us to our next accountability strategy, technology enhancement. So the question here is, can a system or server be accessed off-site? Does the current child care system infrastructure limit the ability for a worker to perform their job duty in the same capacity they would on-site? Is there a need for system changes or enhancements? Which brings us to resources. Agencies can review the various pieces of their off-site working process to ensure their workers have essential resources to complete their job duties, whether it's software or hardware. It's hard to hold someone accountable if they're not provided the tools or resources to be successful. So as we move on, let's close out this section and look at a few of the process accountability strategies related to internal controls for fraud detection. So here we see there are process accountability strategies that stretch across the program to assist in the internal controls related to fraud detection. And again, this is not an all-inclusive list, but on your screen there are process accountability strategies for staff that include separation of job duties and giving responsibility of appropriate oversight, building partnerships with providers and participants, providing clear guidance about performance measurements and reporting to vendors, contractors, and sub-recipients, especially in those written agreements. And while I won't read all of these other activities, the presentation is available for download in the pod to the right of your screen, and you should have received it prior to the webinar. And if you're unable to download a copy, please reach out and we'll certainly forward it over to you. But what I will say here is that these process accountability strategies, excuse me, for internal controls for fraud detection and others like them are collective approaches to supporting, strengthening, reviewing, and testing the lead agency's accountability strategy. And any effective and efficient accountability strategy, when appropriately implemented, can have a positive impact on the agency's program integrity effort. So with that, we'll close out the process accountability area, and we'll chat for a couple of minutes here and talk about it. So on your screen, there are two questions. They haven't appeared yet. There we go. So on your screen, there are two questions. We'll take a moment, and for each of these questions, type in your response, in the correlating box to the question. Question one being, what accountability tools have you implemented to support teleworking? And question two, discuss any fraud detection strategies used to deter internal fraud. And that can be from a program integrity, or an accountability aspect when discussing your fraud detection strategies. And what I'll do here is I'll read off about 3 or 4 of the responses from the group here. So Valentine indicated for teleworking support, reporting time and work completed deadlines being met, and for fraud detection, Valentine indicated reconciliation of activities. We have a couple of more people typing here. And if you see a response or hear a response you would like more information on, we're always here and eager to pair up agencies to have those in-depth peer-to-peer discussions. Tamika Clayton, supporting teleworking, weekly submission of telework logs. Yep, Philip says the same thing, monthly staff logs. Excellent. All right. All right, so I'll now turn it over to Michael McKenzie to discuss maintaining program accountability. Thank you all for your time.
Thank you, Janae, and good afternoon, everyone. So we've discussed tips for maintaining fiscal and process accountability. Now I would like to wrap up this part of the conversation and offer some strategies for you to consider to help you maintain CCDF program accountability. So to get started, let's review the federal guidance first. 45 CFR section 98.68 sub A, and I know Shannon already touched on this. This really applies across the board to fiscal, process, and program accountability. But again, it's the idea of having policies and procedures in place that ensure compliance with the regs, but also maintain continuity of care for the children and families that we serve. Most of you are probably familiar with Section 8 of the state plan, also that instructs you to describe strategies in place for, among other things, risk assessment, proper training for providers and staff, and regular evaluation of your internal control activities. Finally, 98.70 provides guidance for quarterly and annual CCDF reporting. We're all familiar with the reporting requirements. These strategies and data are crucial to making informed decisions on the effectiveness of policy and process changes you are considering and help you to make your program better. By answering some basic questions up front, we believe the lead agency can better understand the need for any change that you make, communicate the change, and effectively implement that change. Questions to ask include, why is this change needed? Who will be affected? When will training be provided? Where do we document the change? And what do we have in place to assess the effect of this change? Now, these are just some of the questions to ask your team as you make changes to improve your program. Change is constant, so find a process that helps you and your agency succeed. Use data you are already collecting to provide your agency with insight to develop a policy or procedure that ensures effectiveness, efficiency, and equity while maintaining program integrity and accountability. Data analysis also allows the lead agency to identify any possible barriers to take a proactive approach to those challenges. Useful data points you are already collecting include error rate data, which can help you find out where your errors are, why they're occurring, the ACF 800, or 700 for tribes, that provides estimates of families and providers served and supported, and the ACF 696, or the 696T for tribes, that details information on expenditures for your CCDF program. The lesson here is make administrative data you are already required to collect work for you. Don't make it just an exercise in reporting. Use the data to inform changes and identify possible barriers to program integrity. Within the current and new state plan preprints, you are asked to include descriptions of the results of some of your program integrity activities. Identifying and communicating the results of your activities can assist in training, in identifying training needs and policy development. It informs your administration and legislature of the positive impact of program integrity. It instills confidence in the general public that their tax dollars are being protected. And it provides OCC with crucial data to improve program operations nationwide. Now here's a good example from Minnesota's lead agency to describe the results of their child care fraud investigations. You can see that they outlined how many cases they investigated, how many claims they established, and for how much. Communicating this information accurately and regularly can help you improve your program, and it can have a deterrent effect on those that may be considering trying to take advantage of the benefits that a family really needs. On this slide, we provided some other ideas for results you can communicate related to program integrity. And as I mentioned before, this will be required in your upcoming state plan submittals. If you're looking for assistance regarding what and how you can report some of this information, please reach out to your regional office for assistance or look for the upcoming preprint training coming to your region. Now, I know that there's been a couple of preprint trainings that have already been offered, but there's lots of assistance out there if you need it. We're here and ready to help you. Okay, so let's just take a few minutes and get some feedback about some of the things related to what I just presented. Please use the chat box to share your information with the rest of us. Specifically, we're wondering, can anyone share some of the results that you're tracking right now to measure the success of your program integrity efforts? And additionally, well, you know, we've all gone through a lot of changes, especially in this last year. And we're wondering, have you made any policy or process changes that were originally temporary, but now you plan to maintain? So we're going to take just a few minutes and see what kind of responses we get. The good news is it looks like the audio is back on for folks that didn't have it before. Better late than never. We got a few
Would anyone
folks
like to share their the results?
Looks like we have a few people typing, Leanne. Looks like Valentine says that they haven't made specific changes, but they've made some updates to some of their policies to better serve our grants. And of course, Michelle brings up the fact of telework, as Janae mentioned before. It makes sense in terms of what type of work we're doing right now. All right, it doesn't look like anybody else is typing right now, so I want to give New Mexico enough time to present the great information they have today. So this will wrap up my part of today's webinar. I want to thank you all for the work that you do to maintain integrity in your CCDF program while still assuring that parents have the child care they need to support their families. Remember, we're here to assist you if you need help sorting through these requirements. And now, without further ado, Antoinette Ortiz, who's the Data and Program Manager for New Mexico's Early Childhood Education and Care Department, is going to share some information about her department's EPICS system. Thank you for joining us today, Antoinette.
Thank you for having me. I'm very, very excited to present today. Can you guys hear me okay?
Yes,
Sounds
we can
good
hear
to
you.
hear.
Perfect. I just wanted to double check. All right. Good afternoon, everyone. As mentioned, I'm from New Mexico Early Childhood Education and Care Department, and I'm here to talk about our data system, Enterprise Provider Information and Constituent Services, which we refer to as EPICS. So here I want to go ahead and just talk about our data system, what it does for us, how it assists in quality assurance, accountability, all of that good stuff. So first and foremost, EPICS is a new data system that we developed off of our legacy system called FACS. We built it from the ground up and started to go live effective 2018. So effective 2018, we went ahead, worked with our IT, well prior to 18, worked with our IT, started getting requirements, and from there we have this wonderful system that I like to say is very wonderful and has lots of smarts within the system. So first and foremost, EPICS is able to retrieve applications that clients complete online using our MI Eligible tool. And just to give you a little bit of background on our MI Eligible tool, is it serves as a survey that helps screen potential clients, letting them know what they may be qualified for as far as New Mexico programs that we serve or have. Things like child care assistance, home visiting, pre-K, summer food, Head Start, FIT program, those programs that we provide to them. And then part of that survey is to where we actually allow those users to create a login to apply online for child care assistance. And so our data system is able to go into our tool and retrieve that application that the client had filled out, as well as refer them to other programs.
Antoinette? 1 second, folks. Looks like we've run into a little audio trouble. You're back, Antoinette?
Yes, I'm so sorry. I don't know what happened. All right. Hopefully I didn't miss too much or you didn't miss too much. So not only does the online or MI Eligible serve as an online application for childcare, but it also does referrals for our other programs. I believe that's where I left off or got cut off. Sorry. Our data system identifies duplicate records, person, application, children, all of our records going into our system. We do what we refer to as a fuzzy match based off of names, date of birth, different things to identify, okay, has this child been in our system before? If so, yes, let's go ahead and utilize that record and reduce the dual entry of that record or that child. It also allows us to connect to the other records that we have in the system. So I'm just going to make up a name. Little Johnny maybe with pre-K and then is now coming in for child care assistance. So we can actually utilize that same record, which should have the same date of birth, addresses, those different demographics. Excuse me. Another great thing that we do have with this fuzzy match is we have an enhancement that does a sex offender check. So not only are we doing fuzzy matches to reduce duplication in our system, but we're also doing this sex offender check against individuals and provider addresses, which then alerts our program staff as well as background check to perform an investigation if that there may be a potential sex offender within our system. And to back out a little bit, our EPICS program or database includes almost all of our programs that we house within our department. So we have background checks, we have the child and adult care food program, we have summer food, child care assistance, and child care licensing registered providers, as well as pre-K. So before in our legacy system, it was just child care assistance, and now with our new data system of EPICS, we're able to bring in all of our programs to house in one database versus multiple. So moving on to our child care assistance application section, we're able to now capture weekly schedules for our parents, guardians, and children. And in our legacy system, this was written on a piece of paper, and our eligibility interviewers had to manually calculate, okay, this child needs X amount of hours for need for care. Now our system is capable of capturing that and determining based off of what is entered into the system that this is the need for care hours based on the schedules. The system also allows for, if there is a change in circumstance, say grace period or some type of adjustment, the system copies over certain information such as schedules and income records. This allows eligibility interviewers, one, to save time when we do have those clients coming in the door. Well, now not so much in the door, but coming in and making those changes, as well as ensuring accuracy. Instead of having to re-enter the same information that was already there, it can be copied over and ensure less errors of entry. Moving on, based off of CCDF guidelines, our system validates different information within the system. So we capture, just as I believe all of us do, is citizenship, residency, age requirements, need for care, income eligibility, all of these different components that need to follow the CCDF guidelines, we do validations on. We make sure that things are required. We have date formatting. We have different role approvals. We have different smarts or business rules built in to ensure that information coming in is accurate in helping the system do a determination for eligibility for our clients. So based on the client's information entered into the system, eligibility and co-pays are determined. So for instance, if a client is receiving TANF, we would have the system then deem the client a P1, which is what they should be deemed if they are receiving TANF for our program. Another benefit that the program has is we can have one application that can compile multiple household compositions. So we may have a household that has mom and her child and a common child with, say, boyfriend. We're able to have all of that information entered in one application, and when it comes time to the eligibilities, we're able to say, okay, for this particular eligibility, we want a household of 3. For the second eligibility, we would like a household of 4, or whatever the numbers may be. But just to ensure that eligibilities are being determined correctly, bringing in the income and the schedules that are needed for that particular child and eligibility. So that is something great too, where in our legacy system, you were creating multiple cases and having to do lots more work. So very more efficient now with our new data system. Same thing with our placements and contracts, more efficiency. That's what we were going for with our new database. Previously, a contract was, in our legacy system, a contract was created, given to the provider, and then, given back to us after signature of client and provider. And then the worker would have to go into the system after the fact and enter in that placement and approve. Now, EPICS allows almost a one-stop shop. You create the placement within the system in a pending status. From there, you're able to print that contract, get all of the signatures. Once it comes back, at just a click of a button, you can final approve it, and payment is then going to be calculated. So it's simpler, it's more efficient for our workers, and I believe they love that. We also have smarts in our system to allow, or I should say identify, when a contract is being attempted to pay for a given child that would exceed a full-time placement. So we have business rules in the system and warning messages that say you're trying to make another contract for child A, however child A has a part-time one to someone else. You'll need to adjust that contract or adjust this contract because you cannot exceed a full-time placement for a child for the same service time. So lots and lots of wonderful rules that we have in the system that help us reduce worker errors, and as well as our overpayments and underpayments. All right. Now going into our payments. This is an automated process to where payments are determined at the end of each month, and the system looks at the information within the system and calculates accordingly. So based off of information that's entered for our providers, as it reflects their licensing, their star level, their quality rating, and then information that's entered in for the child needing care, the hours that are needing to be paid out. The system looks at all of that information and can determine what payment needs to be going out to ensure that accuracy of payment. So if, for instance, we have a provider that changed star levels in the middle of the month and a child changed age groups from, say, an infant to a toddler, the system at the end of the month will look at and say, okay, we need to ensure we pay up to this point at a 2-star and the remaining as a 3-star, and the same for the age group of the child. So the system looks to verify all changes that have happened in that month to go ahead and pay out correctly the following month. Another thing that we have as a safeguard for payments to our provider is we ensure that the system has a valid active license or registration for that provider before a provider is actually receiving payment. And moving on to, so we have our regular payments and we have our OTOs. Before in our legacy system, if we had, say, a contract that was retroactively approved, and so we needed to pay out 3 months, the system would group all 3 months in one lump sum and pay it out. Now with Epics, we have gotten it to where we break up those payments into monthly increments, which allows us to better accurately audit and see that the payments are being issued out correctly for each month. So that has been super helpful for, I think, staff as well as our audit team. Okay. And I'd like to talk about, we have wonderful tools and reminders in the system that help empower our staff. First thing is approval management tool. So we have a kind of node or area to where workers can go in the system, click on this queue and identify any outstanding contracts, say, or anything that is needing their approval. They can see that list and follow up as needed. With that follow-up, we also have reminders built in the system. So depending on the task that, say, isn't completed within the system, we have reminders to say, hey, you know, you haven't determined the eligibility and it was created X date. If reminders aren't handled in a timely fashion, we also have an escalation level to where supervisors then are notified of eligibility interviewers having not completed something. And of course, that goes on to another level. And this is really just to ensure that work is being done in a timely fashion. We're having accountability to ensure that our staff are doing what is needed based on what they've entered into the system. Next, we go into our reports, which we can run multiple or different types of reports within our system, so it's available to all of our users. To include our audit team and the field staff, We have informational reports, and with this informational reports, we have things that report on eligibilities for clients that are expiring, listing of all of our providers within the system, contract reports, reminders, different things that help our program monitor not only their workload, but also what's going on in the system and can improve as needed or identify certain things that's being asked from their supervisors or from their supervisors. So that's more of our informational reports. Then we get to our payment reports, which we have a report called our CCSB 5000. And what this report does is it lists all of our payments that we send to New Mexico State Financial System, which we refer to as SHARE. This helps us get that picture of, okay, this is what we're going to be paying out to our providers. So payment goes to SHARE, our financial system, and we also receive payment files from that system. So that way, at the end of the day, we can ensure that we're reconciling for the payments that have gone out the door and or outside of our system, and then that have truly gone out the door into our providers' pockets. That helps our audit team reconcile when we have our weekly and monthly pay runs. Lastly, talking about our exceptions report, these reports help identify payments that we flag for a given child to see if we have a child that is being paid for the same service dates. We just want to ensure that the system, one, is working correctly, and two, that everything else is accurate. So we may have little Johnny, but it's 2 part-time 1 placements. That's good and all. So we're not overpaying for that provider for a given time frame. It also, this exception report, we also have the ability to identify payments over a certain dollar amount. So if we wanted to say, bring in a dollar amount of anything over $1,000, that way we can go ahead and look and see if anything stands out that we, have questions on. So that's our exception report that our audit team also uses to ensure accuracy and accountability and that the system is working as it should. I do want to talk about some of the challenges. As you can imagine, having a new data system, there are lots of challenges. First one was definitely building the system, trying to gather all of the requirements, understanding the regulations, the business processes that program has, and ensuring that the system that we're building is working as it should. So building the system was a struggle, and of course after the system was built, then it was letting staff know, hey, we're leaving our legacy system, we're moving on to better and greater things, and so here's some change. We need to start training you. So training was a little bit of a challenge. And then of course the rollout of moving everyone from our legacy system, and both staff as well as our clients from our legacy system into using and living within Epic. So what we did was we did a rollout to where if there was a recertification or say someone coming in our door as an intake, those would then be entered into our system of Epic, and we would close out those cases in our legacy system. Some successes of that was as far as the training and doing the rollout, because we did do areas throughout the state, not everyone at once. We were able to update our manuals. We got great questions from our staff out in the field of how does this work, or when do we do this? So with that, even though, the training and changes are hard, we got amazing feedback from our staff, and we were able to enhance our trainings and our documents for the system as we went along with the other trainings throughout the state. So that was really a good success that we had as far as the challenges that we faced. The system is more efficient, I would say, than our legacy, most definitely. We have smarts that help reduce payment errors, worker errors. We also have an address doctor that helps us to ensure that addresses are correct in the system, and we're not spelling, street with 3 E's, 4 E's, things like that. So we have lots of things that have helped our eligibility interviewers as far as making things more efficient, and also, the reports, having them accountable for things. And, I mean, they love it. So it's a win-win, I'll tell you that. But I am excited to say, lastly, this is my last slide. We are working on a new project which is coming out at the end of this month, which is our provider dashboard. So we're building this interface for our providers to access our system, and through that we're going to be allowing them to approve and deny contracts online, manage staff, review or view payment remittances and payment details that go out to them, view their licenses and registrations that live in the system, child enrollment, and other resources. We're hoping now, during the pandemic, it's been crazy to get contracts back. I mean, it was hard in the beginning of, we had that face-to-face, and now having to really rely on mail and that kind of stuff, it has made contract turnaround a lot larger as far as receiving that. So now we're hoping that that shortens and we can give this ability to our providers to be more efficient, understand or see the contract, see the details, see their payments, all of this wonderful stuff, have them update in real time their employee records of, Antoinette left, she's no longer working here. And so our system actually has more accurate, more real-time data. So I'm super, super excited for this project, which is coming out very, very shortly. And I did want to say the resources that we have on there or that we're proposing are COVID safety, regulation links, provider surveys, different things that will help inform our providers of what's going on within our department and things that would help them. So very, very excited. And I'm very excited I got to present today and show you guys everything that we're doing within our new department of ECECD. But with this, I am done with the presentation, and I'm open to questions if anybody has any questions.
Looks like we have a question that came in from Michelle. If another state wanted to implement the New Mexico EPICS data system, how would they go about it, or who would they contact? So Michelle, what we could do is start a conversation, maybe in a peer-to-peer discussion with New Mexico. And what state are you from, Michelle? You can just type it in the chat box, that would be great. Arizona. So yeah, we can take that back and get with and you can also reach out to your regional office program specialist too, and we'll forward that information over to them to get you guys a peer-to-peer discussion. Does that sound like something you guys could do, Antoinette?
Yes, most definitely. I would love to do that.
Awesome. Randall says, does EPICS collect and store family documentation?
Currently, EPICS does not. We do have on our Am I Eligible survey or tool, we do have to where clients can update or upload certain documents, but we are slowly working on another repository for our documents as far as not having physical copies anymore and going electronically. But EPICS, our data system, does not.
Thank you. All right. So if you guys think of any other questions that you may have for New Mexico, definitely shoot those our way and we'll forward those over. Again, we want to thank Antoinette for presenting with us today and providing all of this valuable information and letting us have a sneak peek at all of the wonderful things that their new data system can do and will be doing in the future. So thank you so much, Antoinette. And I will turn it over. Oh, no problem. Thank you. I'll turn it over to Leanne, our Program Integrity Manager, to close us out today.
Thank you, Janae, and also thank you, Antoinette. I'm super happy that the audio was resolved prior to at least you presenting. I know for the most part, those who are still stuck with us were able to hear all of the presentation, but for those that were experiencing some audio issues, we do apologize for that. But again, happy you stuck with us. So we only have about 3 minutes left, but if you all do have any questions that you would like to continue to type into the chat pod, you are definitely welcome to continue to do that. We can leave the Adobe room open for a little bit, and we'll follow up with any of you that continue to type in anything, goodness, into the chat box. And also anything that you may have for Antoinette. We can also follow up and connect you all after the webinar. Here in the next few slides, we've just included some resources for states, territories, and tribal grantees that we think might be useful to you all. So you can feel free to click on those within your PDF handout. Save the date. So our next webinar will be June 23rd. If you want to place a hold on your calendars, that would be fantastic. I'm also going to go ahead and move us over to the evaluation. We do look at this feedback from each of you, and as I mentioned when we first got started today, we use this feedback from evaluations to drive the content of future webinars. So in addition to having us hear how the organization and usefulness of this content's webinar was, it's also really great for us to hear what topics you would like to hear about in future webinars, or if you would like to share some of your state strategies. This is a good opportunity to go ahead and put any of that feedback that you'd like to share into this evaluation. So if you could please just take about 2 to 3 minutes to complete, we would definitely appreciate that feedback. And again, we do read through each and every one of them, and this helps us to drive the content for future webinars. So with that, I will say thank you to everyone for sticking in with us today. I hope you all have a great evening, and we look forward to talking with you again in June. Thank you.